Shocking medical scandal, the 80s contaminated blood truth. Imagine a world where the medicine designed to save you becomes the weapon that condemns you. This is not the plot of a dystopian novel, but a horrifying reality faced by thousands in the 1980s. A seemingly innocuous decision to use clotting factor concentrates revolutionized care for hemophiliacs in the 1980s, but also set the stage for disaster. These concentrates were pooled from the plasma of thousands of donors, magnifying the risk of disease transmission. Little did the medical community know this innovation came with a hidden price. Early signs of hepatitis infections emerged, but the full threat of HIV was still cloaked in mystery and misinformation. The initial response was woefully inadequate, marked by a lack of urgency and transparency. This tepid reaction allowed the contamination to metastasize unseen, setting a grim stage for the years that followed. As hemophiliacs and other patients received routine treatments, the scale of the catastrophe began to unfold. By the mid-1980s, it was evident that something was terribly wrong. Reports of unusual illnesses and deaths started to surface, but the connections to blood products were not immediately drawn. The statistics were chilling. Thousands were infected, and many began to suffer from severe health complications. Governments and health organizations slowly started to acknowledge the crisis, but for many, it was too late. This period marked a critical turning point. Public health safety had been compromised on a massive scale, and trust in the medical establishment was eroding. John, a once vibrant youth, saw his life unravel after receiving contaminated treatment for a minor hemophilia condition. John, I was meant to get better. John, instead, I was handed a death sentence. Stories like John's permeate the scandal, each a stark reminder of the human cost. Families were devastated, parents lost children, children grew up without parents. The emotional wreckage was immense and was compounded by a societal stigma associated with the diseases. The psychological impact for many was profound. Depression, anxiety, and a pervasive sense of betrayal became common among the victims and their families. This emotional toll often went unaddressed in the clamor for medical solutions and legal redress. Internally, documents from pharmaceutical companies revealed a disturbing level of awareness about the risks of contamination. Yet these companies chose profit over safety, continuing to distribute the hazardous products. Governments, entangled with the pharmaceutical industry, played their part in this deceit. Initially, they were sluggish to respond, and later active participants in obscuring the truth. Whistleblowers, who attempted to bring the issue to light, faced intense opposition and retribution, complicating efforts to expose the scandal. Such mechanisms of deceit not only exacerbated the spread of diseases, but also delayed crucial medical research and treatment strategies, costing more lives. The scandal was not confined to any one country. It was a global crisis. Different nations responded variably, with some taking swift action to safeguard their blood supplies, while others remained in denial, causing unnecessary suffering. This part of the narrative also examines the international efforts to reform blood donation and handling practices. The World Health Organization and other international bodies stepped in, recommending stringent guidelines and oversight mechanisms. As a result, many countries overhauled their blood services, implementing rigorous testing and traceability to prevent a recurrence. These measures have had lasting impacts on global health security and policy. Initially, the media coverage was sparse and often downplayed the severity of the scandal. As the magnitude of the disaster became undeniable, however, investigative journalists played a crucial role in bringing the truth to light. The media became a tool for victims to voice their experiences and demand justice. Over time, the narrative shifted from mere reporting to active advocacy, helping to sway public opinion and pressure governments into action. This shift in media portrayal not only increased public awareness, but also contributed to the eventual policy changes and the push for accountability. Victims seeking justice faced a daunting legal battle. Many lawsuits were filed, but the path to compensation was fraught with challenges. The legal proceedings were complex, often mired in technicalities and delays. Significant cases, such as those in the UK and Canada, set precedents, but also highlighted the inconsistencies in legal protections for victims of medical malpractice on such a scale. Today, the legal struggles continue for many as they seek recognition and reparation for the wrongs endured. This ongoing battle underscores the need for legal reforms to better protect patients from medical negligence. The diseases most commonly transmitted through the contaminated blood were HIV and various forms of hepatitis. These diseases were poorly understood at the time, which contributed to the initial mishandling of the crisis. In response to the scandal, significant advancements were made in both the diagnosis and treatment of these diseases. New screening techniques were developed, and the understanding of viral transmission was greatly enhanced. Today, thanks to these scientific advancements, blood transfusions are safer and the diseases themselves are more effectively managed. However, the journey to these improvements was paved with far too many tragedies. The financial implications of the scandal were enormous. Health systems were burdened with the costs of treating long-term illnesses associated with contaminated blood. Additionally, the legal and administrative costs related to the scandal consumed substantial resources. Compensation schemes were established in some countries to provide financial assistance to the victims, but these were often criticized for being insufficient and tardy. The economic toll extended beyond direct costs, affecting insurance, healthcare policy, and even charitable organizations involved in blood donation and health support. The scandal profoundly affected public trust in blood donation systems. Many people became hesitant to donate or receive blood, impacting blood supplies and complicating medical care. Within the medical community, the scandal spurred a cultural shift towards greater transparency and accountability. It also fostered a more cautious approach to medical innovation, emphasizing safety alongside advancements. Artists and writers have explored the scandal in various forms, creating works that challenge the public to reflect on the ethical dimensions of medical practice and the human cost of negligence. Survivors of the scandal carry the burden of their experiences but also serve as crucial advocates for change. Their stories are not just reminders of past mistakes but also lessons for the future. Many survivors, like Mary, a nurse who contracted hepatitis C, have become outspoken about their rights and the need for ongoing support. "We want to ensure this never happens again," Mary states, reflecting a common sentiment among survivors. Their advocacy has spurred ongoing research and policy discussions, ensuring that their experiences continue to influence health policies and practices. The contaminated blood scandal serves as a stark reminder of what can go wrong when safety and ethics are compromised. Moving forward, continued vigilance is necessary to ensure the integrity of medical practices. Research into blood-borne diseases continues to advance, with new technologies enhancing the safety of blood products. Efforts now focus not only on prevention but also on healing and reconciliation for those affected. This essay concludes with a call to action for all stakeholders in healthcare, governments, medical professionals, and the public to remain alert and committed to upholding the highest standards of medical practice and patient care. This comprehensive exploration into the contaminated blood scandal of the 1980s has revealed the depths of human suffering and systemic failure on a global scale. It has also highlighted the resilience of victims and the enduring pursuit of justice and reform. This tragic episode in medical history serves as a powerful reminder of the critical importance of ethical practices, rigorous safety measures, and transparency in healthcare. As we move forward, it is our collective responsibility to ensure that such a disaster never occurs again, safeguarding the trust and well-being of patients worldwide. To fully understand the magnitude of the contaminated blood scandal, we must delve into its background and timeline. The crisis began in the late 1970s and early 1980s when blood products used for transfusions and treatments, particularly for hemophilia, were found to be contaminated with HIV and hepatitis C viruses. The initial warning signs appeared in the early 1980s, but it wasn't until the mid-1980s that the true extent of the contamination became evident. Despite emerging evidence, regulatory agencies and blood product manufacturers were slow to act, resulting in thousands of patients worldwide being exposed to deadly viruses. By the late 1980s, as the scandal broke into public awareness, investigations and legal battles ensued. Governments and organizations were forced to confront their failures, leading to significant reforms in blood safety protocols and compensation programs for victims. This timeline highlights a series of critical events and decisions, underscoring the need for vigilance, accountability, and the continuous improvement of medical practices to prevent future tragedies. Understanding the background and timeline is crucial for appreciating the context and scope of the scandal, as well as the lessons learned that continue to shape healthcare policies today. While the contaminated blood scandal is often discussed in terms of statistics and systemic failures, it's essential to remember the human faces behind the tragedy. Pause. 2S. Thousands of individuals, primarily hemophiliacs, were directly affected. These were people who relied on blood products for survival, only to find that their lifeline had become a source of life-threatening infections. Pause. 3. Families were torn apart as loved ones succumbed to illnesses they never should have contracted. Communities, particularly those with high numbers of hemophilia patients, were devastated, facing not just the loss of life, but also the stigma and discrimination that accompanied HIV and Hepatitis C diagnoses. Pause. 3S. Beyond the immediate victims, entire communities rallied to support those affected, creating networks of advocacy and support that persist to this day. Pause. 2S. These communities, initially brought together by tragedy, have become powerful voices for change, ensuring that the lessons of the past are not forgotten and that future generations are protected. Pause. 3S. By focusing on the individuals and communities most affected, we honor their pain and resilience, highlighting the human cost of systemic failure and the enduring strength of collective action. Pause. 2S. In the wake of the contaminated blood scandal, the response from governments and healthcare institutions was a complex tapestry of accountability, reform, and, at times, denial. Pause. 2S. Initially, many governments were slow to acknowledge the scale of the disaster. Bureaucratic inertia and a reluctance to admit fault led to delays in both public acknowledgement and action. Pause. 3S. However, as the scandal gained media attention and public outcry grew louder, official responses began to shift. Pause. 2S. Investigations were launched and commissions were formed to uncover the root causes of the contamination and to hold those responsible accountable. Pause. 3S. Healthcare institutions, too, were forced to confront their roles in the crisis. Many implemented sweeping reforms to ensure rigorous screening of blood products and improve safety protocols. Pause. 2. These changes, while essential, came too late for those already affected. Pause. 3S. Compensation schemes were established in some countries to provide financial support to victims and their families, but these efforts were often marred by bureaucratic hurdles and inadequate funding. Pause. 2S. Despite these challenges, the scandal has led to a greater emphasis on patient safety and transparency in healthcare systems worldwide. Pause. 3S. By examining the response from governments and healthcare institutions, we gain insight into the slow march toward justice and the ongoing efforts to prevent such a tragedy from ever happening again. Pause. 3S. Pause. 2S. Amidst the shadow of the contaminated blood scandal, a beacon of hope emerged through the indefatigable efforts of activists and victims. Pause. 2S. These individuals, driven by a profound sense of justice and resilience, dedicated themselves to ensuring that the voices of the afflicted were heard and that those responsible were held accountable. Pause. 3S. Many victims, despite their own suffering, became vocal advocates, sharing their stories to shed light on the human toll of the scandal. Pause. 2S. Their testimonies, often heart-wrenching, played a crucial role in raising public awareness and galvanizing support for their cause. Pause. 3S. Activists worked tirelessly, organizing protests, petitions, and campaigns to demand recognition and compensation for the victims. Pause. 2S. Their relentless pursuit of justice led to significant breakthroughs, including the establishment of compensation schemes and the implementation of stricter safety regulations in blood transfusion practices. Pause. 3S. These efforts were not without obstacles. They faced bureaucratic resistance, legal battles, and at times public indifference. Pause. 2s. Yet, their unwavering determination ensured that the issue remained in the public eye, prompting governments and institutions to take necessary action. Pause. 3S. The courage and tenacity of these activists and victims serve as a powerful reminder of the impact that collective action can have in the face of adversity. Pause. 2S. Their legacy continues to inspire ongoing efforts to secure justice and prevent future tragedies. Pause. 3S. By recognizing their contributions, we honor the spirit of resilience and the pursuit of a safer, more transparent healthcare system for all. Fast forward to today, the ripple effects of the contaminated blood scandal continue to shape and redefine medical practices worldwide. The lessons learned from this harrowing episode have led to unprecedented changes in protocols, regulations, and standards within the healthcare industry. One of the most significant transformations is the stringent screening process is now mandatory for blood donations. Advanced testing technologies and more rigorous donor criteria have been implemented to ensure the highest safety levels, drastically reducing the risk of contamination. Additionally, there is a heightened emphasis on transparency and accountability in healthcare institutions. The scandal underscored the necessity for clear communication between medical professionals and patients, fostering an environment where informed consent is paramount. Another profound impact is the global collaboration on health safety standards. Countries now work closely together, sharing data and best practices to protect public health on a broader scale. This collective vigilance has led to the establishment of international guidelines that safeguard against similar tragedies. Moreover, the scandal has fueled advancements in research and development of synthetic blood alternatives, promising a future where reliance on human donors may be significantly reduced. While the journey to these reforms has been paved with pain and loss, the enduring legacy of the contaminated blood scandal is a more resilient and conscientious healthcare system. It serves as a poignant reminder of the critical importance of ethical practices and the relentless pursuit of safety in medical care. As we look ahead, the commitment to these principles continues to drive innovation and trust in healthcare, ensuring that such a catastrophe never recurs. If you found this story eye-opening, don't forget to like this video and subscribe to our channel for more deep dives into the most shocking and impactful stories in medical history. Share your thoughts and let us know what other topics you'd like us to cover. Stay informed, stay vigilant, and let's work together to ensure such tragedies never happen again.